Welcome, and thank you for taking the time to watch this video demonstration on meaningful use, how to achieve the core and menu measures. This video will cover core measure number 13, clinical summaries. Let's get started. First, let's open up the PDF from the MTBC website on clinical summaries. This is the eligible professional meaningful use core measure number 13 out of 15. Provide clinical summaries for patients for each office visit. And the measure here is to provide clinical summaries to patients for more than 50% of all office visits within 3 business days. And an exclusion would be any provider who has no office visits during the EHR reporting period. Let's take a look at some of the definitions of terms and then talk about how this is provided through the MTBC EMR. A clinical summary is defined as an after-visit summary that provides a patient with relevant and actionable information and instructions containing the patient's name, provider's office contact information, date and location of visit, medication lists, updated vital signs, reasons for visit, procedures, and other instructions based on clinical discussions that took place during the office visit. It also includes such things as immunizations and medications, a summary of topics covered, as well as diagnostic test orders and results. Office visits are very straightforward. Those are just the patient encounters inside the office. The attestation requirements for this measure are again numerator, denominator, and exclusions. The denominator would be the total number of office visits that you have during your 90-day reporting period, and the numerator would be the number of office visits in the denominator for which the patient is provided a clinical summary within 3 business days. So for this scenario, if you provide a patient a clinical summary, you'll count that as 1 in the numerator. And that resulting percentage of numerator versus denominator should be greater than 50% in order to meet this requirement. Let's take a look at some of the additional information here that's relevant for this measure before we talk about how this is provided through the MTBC EMR. Again, with this measure, you are permitted, but not required to, limit this measure to only those patients who are in the EMR. So, for example, if you're currently in the middle of adopting the EMR or transitioning to the EMR, you do not have to count those patients as part of your denominator or numerator. And the same is true for the clinical summary. It's just the clinical summary of material that's contained in the EMR. So if you still have remnants of the patient record, the manila folder that you keep in the wall, it is not required for you to have that information also provided electronically as part of a clinical summary. And the third piece of important information is that this clinical summary can be provided through a PHR, a patient portal on the website, secure email or USB or CD, or even a printed copy. And as we saw with the previous clinical summary requirements, if you feel that there's any information that may harm the patient or disclosure of that information is not necessary, you may choose to withhold that information from the clinical summary. Let's go ahead and take a look at how clinical summaries are provided through the MTBC EMR. The MTBC EMR is directly integrated with MTBC's PHR service, or the Personal Health Record Service. As an MTBC client, we will build, design, and host a website for you and for your patients. And on that website, patients can access information about your practice, your working hours, your accepted insurances, and directions to your office, as well as access a secure patient portal that provides them access to their clinical information that is stored in the EMR. Let's take a look at this patient's account, Esther Johnson. Here, this patient has demographic information including insurance, a list of her current and past appointments, a health summary that includes current medications, vital signs, and assessments, and a list of all of her previous encounters. And her chart also includes a series of scanned images. All of this material is synchronized with MTBC's personal health record that your patients can access directly from your website. Let's take a look. Here we have a sample PHR website. This would be a website for your practice, where patients can meet the doctor, view your accepted insurances, get directions and office hours, access patient education and billing resources, as well as complete online forms for your practice. The key portion of this website is the patient login section, where your patients can create a secure account to access the material on the PHR website. Let's go ahead and log in. Once we've logged into the secure portal, the patient can access appointment information, a health history including conditions, medications, allergies, and more, as well as payment reports detailing all of their past payments to the office, claim histories, secure messages, and scanned images. From the PHR login, patients can also make an outstanding payment to your office for any balances that are currently due. But let's take a look at the health history information. Here, patients can see their current assessments, medications that have been prescribed or documented on the record, current lists of allergies, procedures that had been performed in the office, immunizations, and lab results. Additionally, patients can also update their demographic information, and patients can see a copy of their scanned images. Additionally, there's a secure messaging portal where patients can submit messages to your office staff and receive responses back directly from the EMR. Activating the patient portal and providing your patients access to it meets this requirement for core measure number 13,